President Cyril Ramaphosa has returned from Senegal into an urgent cabinet meeting to decide on whether South Africa will need further restrictions as COVID-19 cases soar in the country. This yesterday as the country passed the grim milestone of 90,000 deaths since the start of the pandemic. The 13,000 new infections represent a climbing positivity rate. It's now at almost 25%. Professor Koleka Mlisana is the co-chair of the Ministerial Advisory Council on COVID-19, and she joins us now to unpack what might be on the agenda this morning. Prof, thanks very much indeed for your time. Perhaps before we get to that urgent Coronavirus Command Council meeting that the President said that he would be convening at some point today or tomorrow following that cabinet meeting, given the projection, the increase in cases that we've seen just over the past few weeks, Prof, what are some of your concerns this morning?
Good morning, Michelle, and good morning to all the viewers. Thank you for having me. So, as you correctly say, we have been seeing this exponential, growth in cases. And what I think everybody now almost, has heard that we are seeing this increase of infections. We now know that this is driven by the newly discovered variant, which is Omicron. And what we also are seeing is that we're seeing infections both in the vaccinated and in the unvaccinated individuals. Mm-hmm. And we have also noted that, Omicron, there's now an increase in reinfections, which means people who may have been exposed previously and therefore would have developed some protective immunity, they are becoming, infected. And so with those reinfections, what it therefore says to us that Omicron actually is highly transmissible. And in fact, we are beginning to think it probably is more transmissible than Delta. Mm. And secondly, we are, data is showing that there is a level of immune escape, which is why those that have been, infected before are getting reinfected. Yeah. So as far as cases is concerned, that's where we are. Then the next bit becomes, yes, we know, 80%, almost 80% of people have actually been exposed, and therefore they would have, some form of immunity. And there's vaccination as well. The important thing is how then is it behaving on the clinical picture. So what we are currently doing is to monitor the clinical picture very closely. Where are we sitting with hospitalizations and how severe are those infections? How many people are requiring oxygen? And so that really is where we are at the moment.
So, Prof, what you've said just now really echoed from what Dr. Anthony Fauci in the U.S. had to say around the Omicron variant. I believe it was yesterday. You've said it as well now, Prof. It's definitely more transmissible than the Delta variant. Can we yet take some comfort in the fact that, or the projection that, I should rather say, the projection that it's not more severe than the Delta variant?
So far, we are not seeing the severity, Michelle, because if we're looking, obviously we keep saying this now, we're going to see this in 2 to 3 weeks, and we're already on to the second week now. And as you have heard, almost everybody, the cases that we are seeing, they are mild cases. And in fact, even those that are in hospital, you're finding that the majority of them are in general wards, and there are very few that are actually in the ICUs. So this looks like it is not as serious, but we don't want to, we really are all crossing our fingers. Yeah. But it looks like the majority, as we speak, was looking at a mild, presentation, clinically. And what therefore becomes important is also we know that the people that are vaccinated, they will clear the virus much quicker than those that are not vaccinated. And there have been anecdotal reports that the majority of patients that are admitted for COVID are actually the non-vaccinated, which is why it takes us back to saying, let's just make sure that every South African gets vaccinated. Yeah, Prof, the mild disease thus far.
Yeah, Prof, the other issue that came out of some of the preliminary findings from hospitals in Tshwane is that quite a large number of the people who had COVID-19 and were in hospitals in Tshwane were incidental cases. So they were cases that were identified because they were in hospital for other reasons.
And that actually points to the fact that the disease is mild and that people are coming into hospital for other medical conditions. And because the hospitals now are testing every admission, for COVID. And so that's why we're finding this increase. In fact, even with the issue around, finding it more in children, it is because we're testing everybody who's getting admitted, and that is why we're seeing this. So it really is incidental.
Yeah, that was actually my next question for you, Professor Mlisana. The issue around more children now apparently testing positive for the virus. Children as young as 5 years old. Again, what do we read into that?
No, as I have said, and I think there's more clarity that's coming out now insofar as children are concerned, that actually we are picking up the COVID infections in children incidentally because they are in for other, medical conditions. And that's why there seems to be an increase. Basically, what it is saying to us is that it is also, getting transmitted to children, and therefore we do need to watch on that. But so far, like I say, even for children, we really have not seen, severe illnesses due to COVID specifically.
Yeah. The next question, insofar as the discussion around COVID-19 and children is concerned, Prof, is the question around vaccines. Other parts of the world are already giving children aged 5 to 11 years old one dose of the Pfizer vaccine. Where are we on that decision?
Okay, I think as a country, remember we have actually been prioritizing certain age groups, and in fact right now, even for the those that are above 12, who are still saying a single dose, but now there's evidence to say actually it's time to give them the second dose, because we were actually wanting to get a closer look at some of the side effects or adverse events that were related. And I think we're at a point where now we can say probably a second dose for the for the adolescents is safe. Now, as far as children under 12, we are looking at the data, and as soon as there's actually enough data that's actually showing the impact on children that are under 12, there will definitely be a decision that we then put forward to government.
Yeah. Prof, the issue around vaccines at the moment comes with the discussion around vaccine mandates. We're told that will be on the agenda when the National Coronavirus Command Council meets as well.
Oh, that's very important. I mean, really, we are sitting at a point where everybody now, globally, we know that vaccination is actually probably one most effective way of preventing disease, and it is actually what is going to assist us in living with the virus going forward. So it really becomes important and we have seen the positive impact of vaccination on severe disease, hospitalization, and death, which is the key reason why we do immunization. So where we are now, we really are saying it's actually almost late. We need to consider what are certain environments where vaccination must be mandatory. And for me, it always takes me, the first part is the first line, workers, frontline workers, especially where there's a high risk, and the health, service becomes the first one. And also, if we're looking at, some of the critical, whether it's areas of education, where the risk is much higher, we really need to go the route of mandatory vaccination. Otherwise, then we're never going to get to a level where we can be able to live with the virus. So really, I'm looking forward to those discussions, exploring where should we be introducing mandatory vaccinations and ensuring that there's support for that. And the best way as well, where actually vaccination is going to start, is where we actually use it as incentives for places of leisure. If people want to go and watch a match, yes, we want to be there and want to be in numbers. If you want to get a large crowd, then make sure that the crowd is vaccinated. And I really think we need to start using such incentives so as to increase the level of vaccination in the country.
Yeah, I mean, it's our first line of defense against another surge in COVID-19 and of course, against another variant of the virus, Prof. And it goes hand in hand with the discussion around whether we need stricter lockdowns in the country.
So insofar as lockdowns are concerned, remember that really the issue of lockdowns is to ensure that the health system is not overburdened. And so that is because now, I mean, we can't talk about level of transmission because there's community transmission, so that doesn't really matter now, which is why we really don't think it would make any sense to have to even consider interprovincial, restrictions, because, it is everywhere. But where then it becomes important is how is it behaving clinically and how is the health system prepared, and we really are hoping and trusting, and those are the reports we've been getting, that the healthcare systems provincially, they are all prepared in case we see a surge, that comes into hospitals. So that's where really is going to be important. And depending on the preparedness then of provincial hospitals, that will tell whether there's a need to actually explore stricter restrictions or not.
The issue around lockdowns, Prof, and the surge in infections that you've just mentioned, from yesterday to today, we've seen almost double the number of COVID-19 cases reported by the NICD. It's now over 13,000 in the report overnight. Do you reckon we're going to get to a 20,000 daily increase by the end of the week, like the projections are telling us?
Well, I won't be surprised if we get to that. I mean, just judging by how transmissible Omicron is. And so really, we are headed for those. And in fact, as it seems, Omicron is more transmissible than Delta, we are probably headed for even higher numbers than we saw in the third wave.
Yeah, very worrying indeed. Prof, just before I let you go, when do you reckon that NCCC meeting will actually convene, and when will we hear the outcomes?
Actually, I have no idea. I know it's sometime today, but as to the outcomes, I don't know. I am not part of the meeting.
Professor Koleka Mlisana, let me thank you for your time this morning, speaking all things COVID-19, the fourth wave and the new variant. She is the co-chair of the Ministerial Advisory Council on COVID-19. Thanks very much for your time.